I got a note from someone that I used to talk to all the time. We don't talk as much anymore because she's in the federal parliament, not the state parliament. She's a Shadow Minister for Indigenous Australians and she's a Labor member for Barton. And she's greatly concerned, I'm talking about Linda Burney, about the number of people getting vaccinated and the number of people with the virus from Indigenous communities in Western New South Wales. Linda, good morning to you.
Good morning, Ray. How are you?
Long time no speak. I'm really, really well, thank you for asking.
I'm so thrilled to be back.
Well, I'm thrilled to have you back. Now, from the tone of your text last night, you are really, really, really worried about what's happening in Western New South Wales. So what can we do to help?
I am desperately worried about what's going on in Western New South Wales. You are absolutely correct. There are 35 new cases in Dubbo today. So 35 cases in Dubbo, 49 new cases across the region yesterday. It's close to 400 infections out in the western part of New South Wales, Ray, and we need to remember that they're predominantly Aboriginal towns, but there are many non-Aboriginal people in those towns as well. The concerns I have is that the numbers are exponentially increasing. People in those communities feel quite abandoned. Many of those communities, and I know that you know them well, places like Gaduga do not have a supermarket, do not have a doctor, do not have a pharmacy. There is nowhere for vaccines to be dispensed. And the issue is the capacity of people to cope. I mean, in Wilcannia, Ray, 1 out of 4 adults have the virus, and 40% of all people infected in the Western Division are children. So it's the issue of capacity of hospitals and capacity of people to cope that I'm most worried about.
What we're going to do, Linda, is mobilise. I know we have a problem in Sydney at the moment, particularly in southwest and western Sydney. We're going to mobilise this. We're going to get people out there. Now, just say Gaduga. You mentioned Gaduga. Now, you can drive all the way to Walcott, you can go all the way to Lightning Ridge, and you still don't get to Gaduga. I mean, we're talking about very remote communities. Then you're talking about Brewarrina. You're talking about... And there are large Indigenous populations interspersed with other people living in the areas and living quite peacefully and in harmony, and they want to help each other. But if we don't have the facilities there, we've got to take the facilities to them, because I noticed the Chief Executive of the Dubbo-based health service, Carl Grant, an Indigenous man, has urged people over 12 to get vaccinated. He said one of the challenges in Dubbo is that a fairly big cohort of children and youngsters are getting COVID. This new strain seems to affect youngsters. Well, it does that. We know that now by its nature in the big cities. But I'm very happy to make approaches to the health minister. We've got to mobilise. We've got to get out there, and we've got to just get to these remote communities, and we've got to get the Pfizer into the kids, and we've got to get AstraZeneca into the older people, and we've got to look after them.
That's absolutely right. I mean, I just think that the New South Wales government is almost in a parallel universe at the moment. I mean, my electorate, Ray, covers large chunks of the LGAs that are really in a very hard lockdown. So I know what's going on in southwestern Sydney and western Sydney. The ADF has been deployed out to western New South Wales, but an emergency response when there's a problem in remote and vulnerable communities is not going to cut it for the rest of the country either. So there needs to be, as you say, absolute mobilisation of people out there, particularly staff that are trained in COVID management, that are trained in PPE and know what they're doing. And the other thing is that there is really poor transport systems out there. So if people need to be transported, say, from Brewarrina down to Dubbo to get medical assistance, there is no capacity for triage really at Dubbo Base Hospital. They now have something like 15 people in ICU. The capacity for ICU is almost gone out there. So what happens to people after Dubbo? They get transported to Orange, or they have to get transported to Sydney to the big teaching hospitals, which are also struggling. So what I'm seeing out there is an emerging disaster.
Well, we can't ignore it. I mean, one of the things, and people would not argue, that it's not about anti-vaxxers, it's about people desperately wanting to be vaccinated and leaders in the Indigenous community saying, come on, let's get the kids done. It's not about people fighting against the tide, it's about people wanting it and not able to access it. That's what it's about.
Well, there is an absolute patchy rollout of the vaccine, which we all know is the federal government's responsibility. But the hospitals out there are run by the New South Wales government. And there has to be, in my view, a national plan for vulnerable Indigenous communities. I mean, if this thing, it's travelled down the Darling River, if it travels down to the Murray and gets into South Australia, up through the APY lands into Central Australia and over into Western Australia, because of the vaccination rates that you highlighted at the beginning of this piece, it is going to be just devastating.
Well, as I always do with you, I promise I'll do my best, and that's all I can do, and I'll talk to the appropriate authorities and see if we can get some mobilisation out to the areas that need it desperately.
Thank you so much for having me on, Ray.
It's always a pleasure, Linda. Nice to talk to you again. Thank you.
Bye-bye.
Bye-bye. That's Linda Burney, Shadow Minister for Indigenous Affairs, a proud Indigenous woman herself, and the member for Barton in south-western Sydney, was former member of the Carr government, a very capable minister there, and that's one we used to have our regular chats, of course, and I've always been very supportive of her because I think she's a fine woman who does a fine job. No new local cases in Queensland.